Gretchen Morse, and about 16 years ago there was a change in our society where people were starting to think about what makes a healthy community. Part of it was because the national government was moving sort of away from a fee-for-service and into managed care, which is not unlike some of the conversations that are going on today. And the Medical Center Hospital of Vermont met with leaders at United Way and said, you know, in order for us to be able to control costs and really look at community health from a broadest perspective possible that would reduce the necessity for high-level medical and costly medical care, it said, what can we do to build better relationships with the key players in our community? And one of the things that research really told us at that time was that the assets that make a healthy community are found in the natural environment, in the social context, in the economic sector, and in the physical health and well-being of the residents of that community. So we started to think about, well, how would we approach this large task of thinking about what would our community look like in the context of those four assets, if we were to really build on them and start to measure our progress. So that was sort of the foundation of it. And then with the help of the resources from the Medical Center Hospital of Vermont, which is now Fletcher Allen Healthcare, we started to gather people together. We started to look at what those relationships could look like, how the continuum of care could work better, and also how the other factors of building a healthy community could work in concert with the physical, social, and the health of the actual population. So that's what we gathered a lot of people together. I think one of the great results of the effort was a vision that was created by 250 people from all walks of life in this community that got together over a long period of time to create a vision, to put a stake in the ground on certain things that were also consistent with the assets that I just talked about, and were willing to commit to measuring their progress and achieving results in those areas that were in the interest of the common group. And it wasn't an easy process, but I think what the Champlain Initiative has left us with is a great vision for this community that I think just can live on for many, many years. And also a process that involves ethical leadership, investing human capital and resources into a good process with good information that's inclusive and respectful. And if you do that, generally you can begin to change any community condition for the better. And that process is important. So the other legacy, I think, from the Champlain Initiative has really been the ability for people to work better together. And we always have our challenges, but there is a roadmap. There is a cultural shift in how leaders do business in this community. I do think they talk better together. Certainly the Planning Commission, Regional Planning Commission, the Metropolitan Planning Organization, United Way, the regional Lake Champlain Regional Chamber of Commerce, their plans are more consistent. They're sort of working toward that vision and certainly keeping people informed and engaged. So some of the very specific results of those early days were in the area of community connections, where the committee wanted to find the capital infrastructure for a replacement of child care services and senior care services in the north end of Burlington, and they created the Multi-Gen Center. So that was one of the results that came out of that group. There was a group that was interested in information sharing and data gathering and really connecting people to the right resources in the right places at the right time, and that resulted in an informational and referral service in Chittenden County, which later merged with Windham County and created a statewide system called Vermont 211. So that was another result that came from, I think, these looking at the assets in the broadest context of health and also through a legitimate process for community change. And we also saw some issues regarding the immigration and the refugee resettlement of people into the Burlington area, and through that created circles on racism in partnership with the school system and the Peace and Justice Center, and really tried to make this part of Vermont, at least, more welcoming to people from other countries. That was another output of one of the committees that really wanted to really make our community more inclusive and more equitable among people. There were a lot of other examples over the years, and I think there again the chief bottom line is this framework for really moving communities ahead on conditions that they want to improve on. There's a model, there's a vision, and I think that stays in place. If people want to use it, it's there, and certainly we've learned a lot about how to do things. And we know that as a result of some of the work of these committees, that we can, in fact, as a group of people, work together for community change. The early participants in the Champlain Initiative were really the community leaders at that time. I think it was the mid-90s was a really good time to really think about looking at our community from a very broad perspective with regards to its health and its future. So the mayor at that time was incredibly interested in this project, and his legacy project actually also came out of the Champlain Initiative. So Peter Clavell was an important leader. Certainly the Medical Center Hospital of Vermont, now Fletcher Allen, had enormous resources that they contributed, both in terms of their personnel and in terms of their financial help. And the leader of the hospital, Jim Taylor, at that time, was very pivotal behind the scenes, but incredibly important in really creating the resources for us to do this correctly. The two leaders, the ethical leadership, were so respected among our community, and it was a college president, Sister Janice Ryan, and a local businessman, David Coates, who really convened, kept things in motion, set the tone, and really culturally changed the way people viewed each other, understood each other, and did their business. And I think that is part of what makes the legacy for the Champlain Initiative very strong. Other people were at the state level. We really had people at the table. Con Hogan, who was then Secretary of the Agency of Human Services, was incredibly interested in approaching health care from this broad perspective and really looking at how we could work together as a full community. It's everybody's business. So certainly local, state, regional Chamber of Commerce. At the time, Wayne Roberts was the executive director. He was at the table. And the other people who were strong leaders were the people who interfaced with Fletcher Allen and healthcare and was really part of that continuum of care where those relationships were important. The Howard Center, led by, at that time, Jim Letty, and the Visiting Nurses Association, which is now led by Church Hines. But certainly those two organizations, which were two of our largest, most influential social service nonprofit organizations, were pivotal to bringing the influence and stature to this project. In terms of the real resources, the people who invested either their time or their money, those were the key people. The University of Vermont was going through a transition at that time, but Tom Salmon was the interim president, and he certainly also convened a group of his top advisors, and they were at the table. There really wasn't a stone unturned, and we really needed a broad representation of people from many, many groups, and those groups were involved with senior services, children's services, alcohol and drug services. The Forum on Sprawl came out of this, so there were people who were interested in the physical nature of our environment and its effect on people's health, and many, many other organizations. Peace and Justice Center certainly was there for the equity issues and for the social justice issues. And we all were part of that steering committee that made this thing work over time. And as I said, for many, many years, there were probably 250 people involved in doing their work differently wherever they came from as a result of these relationships that we built.